Hello readers of What's Z. Welcome to another informative episode. Today we're diving into the world of a tiny creature with a big impact, the malaria parasite. This parasite is carried by mosquitoes and can cause severe health issues. This microscopic troublemaker causes a serious illness that affects millions of people worldwide. We call this illness malaria. It can lead to high fevers, chills, and other severe symptoms. It makes millions of people sick every year, mostly in warmer parts of the world, particularly in tropical and subtropical regions. Malaria is not contagious like a cold or the flu. You can't catch it through casual contact. You can't catch it from being near someone who has it. It requires a specific mode of transmission. Instead, it spreads through a very specific type of mosquito, the Anopheles mosquito, which thrives in certain climates. Malaria is a serious health problem, but we can understand it and fight back with the right knowledge and tools. Let's learn more about how malaria works, how to prevent it, and what treatments are available to combat this disease effectively. Imagine a creature so small you need a microscope to see it. That's the malaria parasite, a single-celled organism with a nasty habit of making people sick. There are different types of malaria parasites, but the most dangerous one is called Plasmodium falciparum. This tiny terror is responsible for the most severe cases of malaria. The malaria parasite has a complicated life cycle. It needs to live in both mosquitoes and humans to survive and reproduce. This makes understanding its behavior crucial for developing effective prevention and treatment strategies. The story of malaria transmission begins with a bite, a seemingly harmless bite that carries a deadly secret. Not just any bite, but the bite of an infected female Anopheles mosquito. This mosquito is the primary vector for malaria. These mosquitoes are the only way malaria parasites can spread from person to person. Without them, the disease cannot be transmitted. When the mosquito bites an infected person, it sucks up the parasite along with blood. This is the first step in the parasite's journey. The parasite then multiplies inside the mosquito. It undergoes several stages of development within the mosquito's body. When the mosquito bites another person, it injects saliva into the skin to help with blood flow. This saliva contains anticoagulants. This saliva now contains the malaria parasite, which enters the bloodstream of the new person. The cycle of infection continues. Once inside the human body, the parasite travels to the liver. It hides and multiplies, preparing for the next phase of its life cycle. After some time, they burst out of the liver and invade red blood cells, where they continue to multiply and spread. This causes the symptoms of malaria. This is when a person starts to experience the symptoms of malaria. Fever, chills, and sweating are common signs of the disease. Malaria's grip: feeling the sickness. Malaria makes you feel awful. It often starts with flu-like symptoms. You might get a fever, headache, and chills. Muscle aches and tiredness are common too. Sometimes people experience nausea and vomiting. Without treatment, malaria can quickly become life-threatening. It can damage vital organs like the kidneys, lungs, and brain. In severe cases, it can even lead to coma or death. Early diagnosis and treatment are crucial for preventing severe complications from malaria. If you experience any of these symptoms after visiting an area where malaria is common, seek medical attention immediately. Fighting back: prevention and treatment. The good news is, we have a variety of tools to fight malaria effectively. Preventing mosquito bites is the first line of defense. Simple measures can make a big difference. Sleeping under insecticide-treated mosquito nets is highly effective in reducing mosquito bites. So are using insect repellents and wearing long sleeves and pants, especially during dawn and dusk when mosquitoes are most active. These simple actions can significantly lower your risk. Medicines can also prevent malaria. They are particularly important for travelers. Talk to your doctor about anti-malarial medication if you're traveling to a region where malaria is present. It's a crucial step in staying healthy. If someone does get malaria, medications can treat it effectively. Early diagnosis and treatment are key. Early treatment is very important for a full recovery. The sooner treatment begins, the better the outcome. Global efforts to combat malaria focus on research, prevention programs, and improving access to treatment. These efforts are crucial in the fight against malaria. There's still work to be done, But with continued effort, we can reduce the burden of this disease. Every step forward brings us closer to a malaria-free world. That's malaria in a nutshell. It's a complex issue, but one we can tackle together. What questions do you have about this mosquito-borne illness? We're here to help. Let us know in the comments below, and we might just cover them in a future post. Your input is valuable to us.